assistance program.
Thank you so much, Brian. Vice Chair Salinas, Vice Chair Hayden, and members of the committee, for the record, my name is Rachel Prusak. I'm the state representative for House District 37 and a primary care provider. This moment is personally monumental. In 2019, I led on a bold policy to increase access to primary care. And as a new legislator, I hadn't yet built the coalition or spent the time needed for such a heavy lift. But I persisted. If a primary care trust wasn't the right model for Oregon, I wanted to find out what this legislative body could do to improve access to comprehensive primary care. So in 2020, I had the honor to co-chair the Universal Access to Primary Care Work Group with Representative Maura Green, and I'm proud to bring you House Bill 3108, a product representing that group's top policy recommendations with broad stakeholder support. With many of our members being healthcare clinicians working on the front lines during a pandemic, the pressures and challenges of this past year were felt sharply within our group. I'm extremely proud of our work group and their dedication in the midst of such challenges. The members were a diverse group of primary care stakeholders, including practitioners, behavioral health, specialty providers, health system representatives, coordinated care organizations, payers, health economists, a rural health expert, and a consumer advocate. Together, we built a clearer understanding of current barriers to accessing comprehensive primary care. Despite our various perspectives, we agreed on the need to address access barriers like income, insurance, status, affordability, geographic distance, and race and ethnicity. The pandemic has emphasized this need even more and highlighted the disparities in health outcomes across Oregon, and we must do better. Research consistently demonstrates that access to primary care reduces disparities in health outcomes, improves health system efficiency, and reduces overall health system costs. Unfortunately, primary care is incredibly underutilized in our state. A quarter of Oregonians report not having a personal health care provider, which is higher than the national average. The rates are even more alarming for all BIPOC populations, but especially Hispanic communities, who have a rate of 17.5% higher than the rate for all adults. We must do better. While the benefits of comprehensive primary care are clear, over a third of Oregonians report being underinsured, forgoing preventative care visits, leading to worsening illness and more severe, expensive treatments. Oregon ranks as the second worst state in the nation for adults who report lack of mental health treatment within the last year, and we must do better. Mental and physical health are inseparable. We can no longer accept behavioral health care as anything else but primary care. We can create a system that reflects this reality and minimizes the many barriers to accessing mental health care. I'm confident the policies in House Bill 3108 will enhance Oregonians' access to affordable, comprehensive primary care. The bill requires insurers to provide reimbursement for 3 primary care visits annually, removing the often prohibitive point of service cost sharing for patients for these visits. This does not require a minimum visitation, just a minimum in coverage. Remove multiple copays for behavioral health services on the same day or in the same facility as primary care services. Remove requirements for prior authorization for specialty behavioral health services provided at behavioral health home or patient-centered primary care home. And require insurers to assign a primary care provider if someone hasn't selected one by the 90th day of the plan year. I'm continuing to work with stakeholders on consensus amendments that will address some valid technical issues with the bill, which I know will be presented today by those stakeholders. I'll close with just some gratitude for Representative Salinas, who as a chair fought for this work group, to Representative Maura Green, who showed up with me every month despite a pandemic and wildfires, to Oliver for showing up to help staff, and to all the members that served on the work group, and to the stakeholders for collaborating on this legislation. Thank you. Together we can further our collective mission to create a healthier Oregon, and together we must and can do better. And first up to add testimony is Jessica Adams,